the next one, general practice. Let me just launch this poll again, guys. So general practice, when I speak to IMG doctors, there's a lot of, some people are very pro it, some people are very anti it. So let me just see, what have we got in terms of a split in the audience today? Have you considered a career in general practice at any point so far? If you're a medical student, if you're preparing for PLAB, some people don't know much about general practice and what it's all about. Okay, so we're up to about 60% voted. Thank you very much. So yeah, 3/4 of you have at some point considered a career in general practice, and hopefully, and 27% haven't. And we'll go through some of the pros and cons and common questions that I get before we talk about applying itself and how you would apply to general practice in the UK. So a bit about myself, then. I'm an educator, and like I said at the beginning of the day, I'm very fortunate to have met many of you guys through social media and also live at some of our training courses as well. I'm now full-time medical education. My passion is to help as many doctors as I can globally to get through their exams and to be successful in their careers, and that's what I've been doing now full-time for a couple of years. I've been lucky to have lots of different roles within medical education, both within general practice and out of it as well. I used to be a PLAB 2 examiner, which I really enjoyed, and also used to appraise other GPs, as well as being involved in the recruitment process for GP recruitment itself. So I've had a really good, interesting career in terms of roles in medical education, and now, of course, we're full-time with Arora Medical Education, and we're trying to help as many of you guys as we can in as very different ways as we can. And I have a strong interest in mindset and putting yourself in the best position to tackle exams. And I've been I'm accredited as a meditation trainer, so I help doctors who are going through stress and burnout, because it's a very real thing that often doesn't get talked about. So that's a bit about myself then. So what is general practice in the UK then? So you probably come across the two terms, primary care versus secondary care. So primary care is essentially anything that happens within the realm of general practice, so treating medicine and helping patients in the community, as opposed to secondary care, which is based in hospitals, whatever specialty it might be. The bulk of UK medicine, or face-to-face consultations, or these days I suppose telephone and video consultations, is done in general practice. The percentage of consultations varies, but the majority of UK medicine is going to, the majority of consultations are going to be done in primary care or by GP. So the bulk of you probably on this webinar, if you're going to end up working in the UK, will probably end up working as a GP. It's known as the gateway of the NHS. So as opposed to other countries where patients may go directly to specialists, the primary care system in the UK is almost the gateway to secondary care. So the majority of patients will come to primary care. 80–90% of that will be handled in the scene of general practice, but some, of course, need to be referred on to secondary care. So that's why it's often termed as the gateway of the NHS. And I guess when you're a GP, you're sometimes in some parts of the world, it's kind of seen a little bit lower than being a consultant in certain fields. So the terms now are starting to change, and GPs are starting to be quite rightly known as consultant generalists or consultant family physicians. So sometimes the perception of general practice not being as high a level as a consultant in the various fields, that perception is certainly beginning to change. And when you qualify as a GP, and we'll talk about the route to how you do that, you're essentially working in independent businesses. So each GP practice, or each group of GP practices, is almost seen as an independent business, and you run that as your own organization, and obviously have links with secondary care for referring patients in. So a brief overview of what general practice is, and we do a lot more teaching, a lot more talks about this in more depth if you need more information. So there are a lot of pros, of course, of general practice, and some cons as well. So let's try and look at some of the pros at the moment. One of the biggest reasons that I think people apply for general practice is flexibility. Flexibility in terms of the way you control your working week. Flexibility in terms of being able to decide which hours you want to work. Flexibility in terms of being able to work in one city and then shift to another city without too much problem. So these are the kind of things that you don't often get when you're in a consultant role in hospital, for example. It can be done, of course, but the flexibility is what drives a lot of people to general practice. Another thing that drives people to general practice is the range of what you're going to see. If you're a born cardiothoracic surgeon, or if you're a born respiratory consultant, you may be very happy seeing respiratory or cardiothoracics or whatever it might be every single day for the next 30, 40 years of your career, and that's great. General practice gives you the ability to see pretty much everything that you've trained for, everything that you've trained for in medical school comes up in general practice. So you might see, for example, in 3 cases of abdominal pain all in a row, and there may be completely different specialties and maybe completely different reasons and completely different bits of medicine that you're seeing. So you get to see acute care as well as chronic, and you see from start to finish. So that's one of the draws that a lot of people feel. If you really love medicine, you've either got kind of acute medicine, general medicine in hospital, or you've got general practice in terms of seeing the breadth of the medical field out there. Continuity of care is another real pro for general practice. In a lot of specialties, you will see a patient once or twice, and then they're referred back to the GP. Whereas as a GP, you get to see the patient from start to finish through their whole journey. You may see someone 15 to 20 times before their journey ends from start to finish. You're seeing patients from the day they're born right through to their last few days of life. So that continuity of care is something that you very rarely get in other specialties, and it's certainly one of the draws of primary care, and why, again, a lot of people love going into the field of general practice. And I remember when I was working clinically as a GP, you'd get to know not just a patient's journey, but the journey of a whole family. So, for example, if I saw a young child come in, I would probably know their parents, I'd probably know their grandparents, I'd probably know a bit about the background of how that family gels together. That kind of insight to someone's holistic care doesn't always happen in other specialties. There's a big draw. Choosing a working week goes back to the flexibility side. You have some GPs who work 1 day clinically in the week. You have some GPs who work 6 to 7 days clinically in the working week. You have some GPs who will not work on Tuesdays by choice. You'll have some GPs who just work afternoons by choice. You will have some GPs who just do out of hours general practice overnight and in the weekends. You really can choose your working week, and that's another big draw for why people apply for general practice at this stage of their career. And because of that flexibility, general practice often gives you time to do other things that you want to do. Now, if you're in a busy consultant post, you may not have time to dedicate to other specialties, whether it's learning other bits of medicine or whether it's completely non-medical interest. Whereas as a GP, for example, you may say, well, I want to do 2 days in general practice and I want to do 2 days working as a GP with a specialist interest in, say, cardiology, where you're doing cardiology clinics in a hospital. You may say, I like acute medicine, so I'll do 3 days in clinic in general practice, and then I'll do 2 days in A&E, for example, working as a GP. And there's very few fields that allow you to be able to expand your work and your interest that way. Sometimes out of medicine. So, for example, my interest was medical education, and only by being a GP could I dedicate time in the week to doing lots of educational based activities. It might have been less of an opportunity for me if I was in a busy hospital rotation. My wife Pooja has a strong interest in medical politics. She's been able to increase her medical politics time because of being a GP and being able to choose where you dedicate your time. So there's a lot of pros of general practice, and for those who apply to general practice, it's important to make sure at least one of these is the reason why you're applying, as opposed to let's just do it as a second chance thing, and I don't really want to do it, but I'm going to apply anyway, because eventually you'll realize that it's not really for you. But there are so many reasons why it could well be. Are there any cons of general practice? Of course, although I've obviously trained in general practice, I may be biased. There are some cons. Some people say that they miss the acute work. Some people say they miss the crash course. Some people say they miss the acuteness of being in an A&E department. And that's obviously going to be the case for some people. If you're someone who likes that fast-paced, on the ward, working in teams, working overnight, then yes, you might miss that in general practice. But like we mentioned, in general practice, you can work as an urgent care GP, where you're only seeing acute patients within the hospital setting. So there are lots of ways around it. Some people say that you can get a little bit lonely in general practice. If you're working in a small practice where there's not many GPs on board, where maybe you're the only GP in for a clinic, it can sometimes for some people get a little bit lonely. But these days, the way general practice is working is that teams are getting bigger and bigger and practices are expanding. So this is going to get less likely, but it's certainly something that I've heard people say in terms of what they found a con to be. Some people say you may get de-skilled in general practice, and I guess this depends on what you classify as de-skilled. Yes, if you're into your procedures, if you're into doing bronchoscopies, if you're into doing lots of practical things that you enjoy doing in a hospital environment, then yes, you may get de-skilled, because within the role of the community, there's obviously some limitations on what's possible to do in terms of procedures, but you can get upskilled in other ways. So there are a lot of GPs, for example, who have a specialist interest in minor surgery, and therefore they are able to get to a very high skill level in doing minor surgery procedures, even though they're working in the realm of general practice. So there are pros and cons, I suppose, of being de-skilled. And the other thing that I commonly get told about in general practice is, well, why would I want to train for so many years in medicine just to see coughs and colds? There's a really big perception that we often hear about general practice. And of course, you're going to see some things that are not to the level of pathology that you might in hospital, but it's certainly not the case that you're only going to be seeing coughs and colds all day. There is so much pathology that you'll see in general practice, and often some of the more challenging pathology where actually the kind of textbook type presentations haven't quite started yet. So you're seeing people right at the beginning, and it can be quite a challenge to deal with seeing people so early on in their presentation. So yes, there are some cons, but I guess it's the way you look at it. What about my own GP journey then? So I was born in the UK, so I'm not an IMG, of course, but I've been helping lots of IMGs. And one of the things I often get asked is, what was your GP journey? Why did you join general practice? And my father was a GP, so I didn't really know anything else, to be honest, while I was growing up. I used to see him going to his clinic. I used to see him going on his home visits. I used to see him going to his GP meetings. So I probably didn't really have any other thing in my mind. But interesting, having said that, I actually wanted to be a cardiologist for many years. So throughout my medical school, I was thinking, I'm a born cardiologist. I don't want to do anything else. I didn't really understand cardiology, to be honest, when I was a first year medical student, but I wanted to be a cardiologist since I could remember, not interestingly a GP, as I used to see my father be every day. Then I did medical school, and I did a couple of GP placements while I was at medical school, and I started to understand a bit more about what general practice is all about, those kind of pros that I was talking about, seeing people several times in their journey, understanding how people work in their family dynamic, understanding how to balance multiple different problems. Someone has chronic heart problems, chronic renal problems, and chronic chest problems, how you have to balance that all up in a balanced way. That was my first real taste of understanding what general practice is all about. I finished medical school. I did my foundation year 1, foundation year 2, and I had a general practice rotation right at the beginning of my foundation year 2 year. And that's when I really got to see patients for the first time as, inverted commas, a GP. And that's where I really fell in love with the profession. And then I applied for GP training. I was on my 3-year GP training program between 2007 and 2010. So I've been a GP since 2010. And like I mentioned earlier, I've had lots of clinical and different clinical GP roles. So I used to work as a locum GP and then a salaried GP, and worked in various different practices, but also lots of GP education roles as well. And like I mentioned, we've been full-time medical education since 2018, where I found my passion for helping doctors boost their own career. So that's kind of why I really didn't want to be a GP at all. And the reason I bring this up is that a lot of GPs originally didn't want to be a GP. A lot of IMGs come across and they don't think about general practice, but then they end up being a GP, not because there was nothing else that they could get into, but because they actually understood what general practice was about and really saw some of those pros that I mentioned earlier. So if you're in that position where you're kind of thinking, general practice is not for me, I don't think I can do it, I really encourage you trying to understand a bit more about what it's all about, and you may find lots of positives that can come up. So if you do decide to be a GP and you want to apply for general practice, what are the key kind of things you need to know from an eligibility point of view? What's the training all about? And how do you apply then? So there are some crossovers from what you've been hearing in the psychiatry talk and a little bit in the IMT talk as well, but it's worth going over some of them as to how they differ for GP training. So GP training is a minimum 3-year specialty training. So it's one of the shorter ones. This is going to go up. There's no way it can remain 3 years for too long. Things might be paused for various reasons, and like pandemic, etc. But this 3-year program was initially developed in the 70s and 80s. So it was designed to at that point, it was considered 3 years is enough, whereas now really you need a lot longer to come out as a GP feeling confident. So the minimum at the moment still is 3 years as a GPST. And in those 3 years, you do at least 18 months in a GP practice. So 18 months usually in kind of hospital rotations, and 18 months is in an approved GP training practice. Usually that's split into 6 months, either being in your first year or your second year, and then your last 12 months of training being in your final GP practice. And then amongst the other 18 months left, you usually go through different rotations, and the common ones that people often go through are these here: A&E, general medicine, elderly care, pediatrics, O&G, psychiatry, ENT, the things that are considered very much needed as a GP. So if you think about the common presentations you'll see in general practice, they may tailor to some of the rotations that you do as a GP trainee. There are a few different changes. So for example, in Scotland, there are some 4-year programs that are started at the moment. There are some posts where you do half the week in hospital and half the week in general practice. But generally, for most trainees, it's going to be a system where you're doing 18 months in general practice and 18 months in hospitals, and you rotate through your rotations. So at the end of your 3 years, as long as you've gone through all of the relevant assessments and criteria, you will receive your CCT, and you will be a fully qualified independent GP, able to work where you want in the UK, how you want, how much you like, and in which type of practice. So you really start getting big choices in your career from pretty early on, and much earlier on probably than some of your colleagues who are in 7 or 8 year training programs in other specialties. So you become an independent GP consultant after 3 years of training. In that 3 years, you need to achieve a couple of things. You need to achieve your MRC GP qualification. You can't be a GP in the UK without MRC GP. So this is slightly different to things like MRCS, MRCP, where even if you don't complete those exams, you can still work at a certain level, SHO level, for example. In general practice, if you don't complete MRC GP, and this may change over time as things develop, you can't work as a GP. There's nothing such thing as a staff grade, for example, or a lower grade general practitioner. And the 3 things you need to do to make sure you get your MRC GP are 2 exams, the AKT exam and the CSA exam, and WBPA, which is work-based placed assessment. So these are kind of regular assessments that happen throughout your 3 years, done by your supervisors. So you've got to clear those off, and you've got to clear 2 exams. At the moment, CSA is replaced by something called RCA because of the COVID pandemic. But if you guys are applying now, by the time you come around to it, it'll be back to the CSA exam again. AKT is an MCQ-based exam, and CSA is an OSCE-based exam. And every year, at the end of each year, you need to clear an ARCP, similar to other specialties as well, an annual review of competency progression. If you do all of your assessments and you're on track, then you will clear these. Once you clear your final one, then you end up with your CCT, certificate of completion of training, and you are a GP. So the normal current pathway, and like I said, there are some changes, is a 3-year window. You have the final 2 years to pass your AKT exam, and you usually do your last exam, your CSA or currently RCA exam, in your GP ST 3-year. And like we mentioned, you have ARCPs 3 times at the end of each year. You have to pass each of those, and you have little mini kind of assessments called ESRs every 6 months, but the main ones are your ARCP. So that's your general 3-year pathway. So if you're thinking about applying to general practice, what are the eligibility criteria? Now, it's really important to have a look at the GP NRO website to get a full list of eligibility criteria, but these are the commonest ones that you'll be looking to make sure you've got ticked off. Of course, you need MBBS or some kind of equivalent medical degree. You need to be eligible for full registration and hold a license to practice from the GMC by the intended start date of training. So for example, the next start date of training is August 2021. And some of you guys may already have applied for that right now. You need to have evidence. This is similar to the other specialties that have been mentioned already. You need evidence of achievement of foundation level competencies in the 3.5 years preceding your start date. So there are a number of ways that you can demonstrate that you have foundation level competencies. You could already be in a UK foundation program. That will indicate that you're likely to have competencies by the end. You could have previously in the past completed a foundation program successfully, but it's got to be within 3.5 years of the start date of that program. You could be currently employed in a specialty training program. So you may already be in a different specialty, but that kind of indicates that you already have the foundation level competencies. Or one of the commonest reasons that someone coming from an international medical background would have to achieve 12 months medical experience plus evidence to commence specialty training via the CREST form that's been mentioned a couple of times already. So certificate of readiness to enter specialty training. this is something that's worth looking at if you haven't heard of this before, and if you're thinking of applying to most specialties in the UK. And we've put links already for our blog about what a CREST form is, which goes into more detail. But this is the commonest way that most of you guys applying for general practice will show that evidence. And the whole reason is to make sure you're demonstrating that you've got foundation level competencies before you start general practice training. Of course, you need to be eligible to work in the UK, and you need either a UK driving license or showing that you've got an equivalent ulterior method of being able to arrange transport. So for example, in general practice, one of the things that you'll be doing when you're in your GP placements is home visits. So going to other patients' houses to assess them, and you've got to be able to demonstrate that you will be able to do that when you're a GP trainee. And the commonest way is to have a driving license, but there are obviously other ways as well. So if you have your eligibility criteria, then you can apply for GP training. So how does the application process work with GP training? There are 2 rounds per year for August starters and for February starters. So other specialties, for example, radiology, will only have 1 round per year, whereas because GP training numbers are so vast, there are 2 starting points in the year for your GP training programs. There's also, this is round 1, this is round 2. There's also a round 1 re-advert sometimes as well. That's not happening this year, but that does happen, and it's just changed because of the pandemic a little bit. Applying for GP training is coordinated by the GP NRO, the General Practice National Recruitment Office. If you have a look at the GP NRO website, maybe Pooja can put that link down in the chat, that will give you a fully, all the guidance that you need will be on this website, but there's a lot of information on there, and it can take a bit of time to go through, so it's worth having it in condensed form. So the whole process of GP training application is supposed to allow you to demonstrate certain abilities and demonstrate your suitability to be an effective GP trainee. So you've got to be able to demonstrate somehow that you have the credentials, the skills, the abilities, essentially someone who is trainable, that can come out the other end of training as a fully qualified GP. And that's the kind of things that will be looked at in your application process. You apply through the Oriel recruitment portal, like in other specialties as well, and there's an electronic application form which you need to fill in. And when you apply, you rank your preferences from all available GP training rotations and programs across the UK. So you have full access to all of the programs, and you need to rank from top to bottom which are the ones that you prefer. And then your assessments will try and match you up against how you ranked to see if you get places. One thing I often see with GP training applications is that people will rank multiple areas and even put things on that list or areas on that list that they don't actually want to work in. And then sometimes they get accepted, and then they actually turns out, actually, I don't want to work in that area. So it's really important to, although it's tempting to add lots of ranks, only choose areas where actually you would like to work if you get accepted. You can amend ranking later on in the application process, but you need to do your initial rank when you do your application. So once the application window closes, and the recent one has just closed a week or so ago, you're invited to register with the Pearson VUE Center. Pearson VUE Center is the place that you will do your MSRA assessment. If you match the eligibility criteria, so then you go through a process similar to what Shanazi was saying in psychiatry, a long listing process where they'll go through your application, make sure you have these kind of eligibility criteria in place, make sure CREST forms are signed off by the right people, etc. If you meet the criteria, then you're invited to sit the MSRA, the multi-specialty recruitment assessment, which have been mentioned already in a couple of talks before. So what is the MSRA? Now, this year, application for general practice is very different to how it's been in the past. So in the past, there used to be 2 stages once you'd apply. Number 1 was your MSRA, and number 2 was something called a GP stage 3, which is a face-to-face type assessment. Because of the COVID pandemic now, GP stage 3 has been cancelled. So it's not going to happen for those applying for August 21 start, and it's also not going to happen for those applying for February 2022 start as well. So there's no GP stage 3 running in the whole of 2021 as per the GPNO website. So everything now is based on MSRA. Your whole application score, your whole application rank is based on your MSRA score. So it's really important that you get this bit right. So MSRA is a computer-based assessment, as Shanazi was saying, taken at various different Pearson VUE test centers across the UK. There are certain competencies that they're testing in MSRA, And if you look at a document called the person specification document, again, on the GPNRO website, it'll explain the different types of things that MSRA is trying to assess you on. And remember, they're looking to see, have you got the abilities and suitability to enter training as a GP trainee. The MSRA consists of 2 papers in 1 assessment. So you get a professional dilemma paper first, which is a 95-minute paper, and then you get a clinical problem-solving paper, which is slightly less, 75 minutes. The professional dilemma paper is made up of SJT questions, situational judgment test questions. These may be types of questions that you've not done in medical school or previously in your training. So a lot of people initially struggle with these types of questions when they first do them. Essentially, they're designed to put you into situations, and they want to see how professionally are you going to react to being in the situation. So they're not testing any clinical knowledge at all. It's all about your professional integrity, how you make decisions, how you prioritize, and the questions for SJT are based around those types of things. There are 2 types of SJT question. There's a ranking question where you're given a situation and you're given 4 or 5 different possible actions, and you need to rank them in terms of which is most appropriate, next appropriate, down to least. Or you get multiple choice questions where you get a scenario given to you and you get 8 different options, and you need to think, which of the 3 would I do together to make the best possible action. Now, one thing that's really important is to try and look at some sample questions, and the blog that we put earlier about MSRA has example questions of SJT, because it's something that maybe some of you guys might have done. So Pooja, if you could just put that blog back out again, the MSRA, what it is, that would be useful for some examples. And then secondly, you have a 5-minute break after this, and then you go straight into the CPS, the clinical problem solving paper, where there are 97 MCQ questions based on clinical things. So investigations, diagnosis, treatment, management, emergencies, and there's a blueprint, there's an MSRA blueprint that tells you 12 different areas that you need to go through: cardiovascular, pharmacology, respiratory, etc. And there are 2 different types of question: extended matching and single best answer. And again, if you look at the blog that will be in the chat, there's examples of the clinical questions as well. So 2 papers. The whole thing takes about 3 hours, 175 minutes to do. There's not really a pass mark. There's no maximum score. Often I'm asked this question: what's the mark needed to get into GP training? The mark is based on performance of everybody in that assessment. So it's different every year, and there's not a level that you need to cross as such, or there's no maximum score. So I wouldn't worry too much about how they calculate the scores. It's just about going in and trying to do your best. And you're given a band. You're given band 1 to band 4 in terms of how you perform. Band 1 is the lowest and band 4 is the highest. Now, like I mentioned, in the past, they used to add the MSRA score to your GP stage 3 assessment score, but because there's no GP stage 3 assessment now, everything is based on MSRA. So the higher you score on MSRA, the higher you're going to rank, and ultimately the more chance you've got against matching on one of the rotations that you ranked when you applied, and ultimately get an offer. So this is really important to remember now. MSRA has become a lot more important in terms of application than it used to, not just in general practice, but other specialties as well. How do you prep for MSRA? One thing we talk a lot about is a dual-based approach. A lot of people just do lots of questions, question after question after question, and that's really good. You've got to keep your brain problem solving regularly. But a lot of people neglect the knowledge buildup. A lot of people neglect the background reading. A lot of people neglect the understanding of the principles and the guidelines. So they'll do lots and lots of questions, but there'll be gaps. And therefore, you're going to miss out on a number of marks if you don't put the time in to do your background building of knowledge. So the dual-based approach is very important. Yes, do lots of questions, but make sure you're constantly building up your background knowledge as well. Question banks, of course, are important. There are quite a few different question banks out there. Some people prefer one versus the other. I don't have any preferences to which one is best. All I suggest is make sure you have a question bank and you regularly go through questions so your brain is getting used to problem solving. Aim high. Often people say to us, what is the mark I should be aiming for? Or like I said to you, what is the mark needed to get into general practice? What I say is, don't think about that. Aim high, aim for 100%. Because if you aim for as high as you can get, then you're going to do well enough to get your preferred job. If you're aiming for a certain percentage, like I'm happy with 70%, then already subconsciously you're letting yourself down a little bit. So aim high. Every question you can get right, if you work smartly and efficiently and you build your knowledge and you regularly test your brain, there's no reason why you shouldn't be aiming for a really, really high score, probably higher than you might have thought you could do in the first place. And don't study alone for MSRA. It can be quite lonely. Often people are praying for MSRA amongst doing their normal work, their normal jobs. And obviously you guys are busy junior doctors, so you can have long on calls, and the last thing you might want to do is go home and study. If you're on your own, to get the motivation to study is quite difficult. Make sure you've got someone who's applying with you, and pull and push each other along. When you become accountable to somebody else, you're more likely to put that extra 10% in if you made plans with somebody else. So try to find somebody else who's also preparing for MSRA. We have a lot of different MSRA resources that are available that go alongside the question bank. So the question banks are there to constantly make sure you're testing your knowledge and testing your problem solving ability, but the knowledge buildup is the bit that we focus on in terms of our resources. The most popular package that we have is our MSRA Gold Pass Pack. And we've developed this package to enable you to learn in 4 different ways to try and build up that knowledge to maximize your question banks. Remember, all these are on discount today. So what does the Gold Pass Pack include? It contains our 2 audiobook courses, and a lot of you guys have used our PLAB audiobook courses. So we've got specific ones for MSRA as well. There's a clinical one for the clinical paper, and there's an SJT one for the SJT paper as well. So these are designed to download to your phone and listen to when you're commuting, shopping, etc. So they kind of allow you to buy time. So even on the days that you don't want to sit down in front of a screen to work, you can still do some work by listening. It also contains our more detailed clinical grammar online course. This is a course that you can watch on screen, pause, rewind, go back to, and it goes through the sections as per the MSRA blueprint, and it teaches you all the investigations, guidelines, tests that you need to know. It also contains 6 online MSRA mock exams, 3 SJT mocks and 3 clinical mocks. We don't have a question bank, but what we do is we put you under that time pressurized situation of doing these assessments under that pressure of time. And they're designed to build upon the knowledge that you've learned from the audios in the online course. And it also contains the flashcards that we have as well that we post out to your house that again go through the high yield guidelines, investigations, and treatments for MSRA. So that's the MSRA Gold Pass Pack. Pooja, if we can just put the link out to that in the chat. And you can buy these things individually as well, but whatever you do, make sure you use that code today because you'll get that 15% off. So what are the dates and what are the numbers that you need to remember in terms of applying for GP training? So as you mentioned, those who are applying for August 21 start, so starting training in August 21, the application deadline has now finished. So if you're in that bracket, you're probably preparing for MSRA at the moment. So the MSRA window is the 21st of Jan to the 12th of February, and results for MSRA and the first offers will come out by the 4th of March. So if you're currently preparing for MSRA, I hope preparation is going well. For those who are thinking about February 2022 start, so this is round 2 application for GP training, the next round 2 application. The window for applying is 27th of July to the 17th of August. So that's when you need to make sure all of your paperwork and your eligibility is up to date by then. The MSRA window is the 3rd to the 10th of September, and the results and offers are likely to come out later on in September. So if you're going to be applying in the next year or so, these are the dates that you need to have in mind. We run webinars, so we do 2 webinars before each MSRA. So if you're preparing for the January MSRA, then it's really important that you get on our free MSRA webinar. And we'll try and put a link in the chat actually for the webinar. If you just go to the website and go to the webinars page, you'll be able to join up to this, because this is where we go through example questions and we show those kind of classic errors in technique that people make, both from a clinical and from an SJT point of view. So if you're considering general practice, there's a couple of things that I'd encourage you to think about before you make the application. Like I said, a lot of people end up applying for GP for the wrong reasons, and then they realize that even when they get a job, that they don't actually want it because they haven't thought it through. So number one, have you got a genuine interest in general practice? Have you actually thought about what general practice is? Has it been something that's maybe caught your attention and you wanted to know a little bit more about? Because if by now you haven't really thought about it, you may well not have that desire or interest to do so. So make sure you really think you've got some interest in family medicine, community medicine, looking at patients in a holistic manner, and then maybe general practice is a thing for you. Consider exploring it first. If there's any way that you can sit in on a clinic, if there's any way that you can do it and arrange a little bit of an attachment, if you have any contacts that they allow you to come and sit in to understand what general practice is about, this is really important. Do some reading, understand a bit about what the primary care system is, and just try and work out a little bit about whether this is something that you can see yourself doing for the next 30, 40 years. Because a lot of people don't do this, they apply and then realize it's not for them, or they assume it's not for them, and then later on they end up going back to general practice because they realize actually this is something I should have thought about many years ago. Consider future careers plans. For example, are you planning to stay in the UK for the rest of your career, or are you planning to come to the UK, do a couple of years, and then go back home? So some places in some countries, for example, having MRCGP, being a GP, may not help in your career plans. So it's important to bear that in mind. If you have an idea about where you're going in your career, where it's going to be, consider that when you think about general practice. Research the areas you're applying to. Like I said, don't just apply to lots of areas. There are some areas where there are incentives to apply, and a lot of people go to those and then realize actually this is not the right area for them. So research the area. Do you know people there? Have you got any family members that are contactable? Have you got any friends there? Do you know anybody else who's lived in that area? Get some advice from them. Don't just tick a lot of places on your ranking without understanding where you're applying to. And then prepare very early, because like we said, this year it's all about MSRA. In the past, you could rely on doing okay in MSRA and then doing really well in your face-to-face assessment, whereas now it's all about MSRA, and you've got to start preparing early, both through doing questions like we mentioned and also background knowledge as well. We do lots of social media teaching for MSRA, so if you haven't joined these things already, please do have a look at these. We like to teach you passively, so when you're not trying to learn, we're still learning, especially through the email system up here. If there's any questions, and I've overrun by about 5 minutes or so, if there's any questions, I will hang around and see if I can answer them. Pooja, just watching that, has there been any core questions that you've seen that are coming out, the popular questions right now that I can answer in 2 minutes?
So yes, quite a few common questions, which I think you have tackled, Aman, about how to what the training system is like. I've actually been trying to answer some of them as we've been going along. And I think somebody's asked, is it a disadvantage to apply in the second round of GP specialty training?
Is it disadvantage? I mean, the thing about GP training is every year is completely different. So people will say one year that, oh, you know what, you should hold off or not hold off because everyone gets in or no one gets in. And then the next year it's completely different because it's all dependent on how many people apply. It's all dependent on how many rotations are available. So it's very difficult to answer that. All I would say is you've got to know when is right for you. Don't apply to a training scheme because you think it might be easier or not easier to do it at a certain time. Number one, you might be delaying yourself by considerable amounts of time, or number two, you might be jumping in too early before you've had enough time to really prepare and understand it. So I wouldn't look at those kind of things because they're so fluctuant. I would go with, when do I feel ready? When do I think is the right time for me? And then go in and hit it as hard as you can.
Bro. I think that most of the other ones, I think it's best for you to answer them in the break, if that's okay, Aman.
Yeah,
I think
that's fine.
That's probably the best way forward. And shall we break up for lunch? Thank you ever so much for everyone who stuck through with us. Hopefully you're finding the day useful and are enjoying all the various talks. We've got some more exciting talks. I know quite a few of you have been asking about surgical training, emergency medicine, obstetrics and gynecology. They're coming up after lunch.